Okay, welcome back to the Sleep Edit. This is going to be our first, I don't know if it's Ask Us Anything,
Yeah.
mailbag episode. I'm Dr. Craig Canaperi,
And I'm Ariel Greenleaf, certified pediatric sleep consultant.
where he
Oh,
said, we
yeah.
asked, do you have any sleep questions? And my son said, these nuts,
Yeah.
which I think is actually incorrect. It's technically
D's
supposed to
nuts.
be these
Yeah.
nuts, but yeah.
He has a lot to learn.
It was the only one like that I got. We solicited questions on Instagram, via email. We also have a email for the show people can send questions to for future episodes, thesleepeditshow@gmail.com. Let's get into it. Let's go through these Instagram ones first. They're short and sweet.
All right.
Okay. What should the light setup be in a toddler's room?
The light setup.
You know, I get this a lot actually. And what I would say to parents is pitch black is the best. But a lot of toddlers and younger kids like night lights. My kind of rule of thumb is, first of all, it should be dark enough in your kid's room that you can't read while you're sitting in the room, read a book. And second of all, if your child insists on having a light, make it so the light is not shining directly in their eyes. You can sometimes put a lamp behind a piece of furniture, etc. The less, the better.
Yeah, I think sometimes people come to me and their problem is, oh, he has to sleep with the light on. And obviously, that's just not conducive to healthy sleep.
Yeah. And there's lots of different things you can do. I think in the last episode with Dr. Gray, we talked a lot about resources for fear of the dark. It can be very useful.
Yes, absolutely. I think it's best to say as dark as possible until your child says something about it. And they may never say something about it, but it may become a thing around the toddler years. But certainly an infant is not afraid of the dark.
Yeah. So, Ariel, this is a good one for you.
All right.
Can you immediately stop using pacifier when sleep training?
Absolutely. So pacifiers can become a dependency. And if they're a problem at night, then it's best to just eliminate them for all sleep. And saying that, it's scarier for a parent than it is for the child. So the sooner you can eliminate the pacifier, the better. I would say it's very hard to eliminate a pacifier with a child over the age of 12 months, probably until age 3. And sometimes it can really backfire. So in those cases, I often say, let's keep it until the child has a better understanding of reason. You can reason with them a little bit better. That's also the time, age 3 is like the time that we recommend for transitioning to a big kid bed or a toddler bed. Similarly, I just find it's very difficult to get rid of the pacifier before age 3. So I would recommend doing it as young as possible. And not after the newborn stage, obviously, because it is a preventative measure for SIDS. But after the newborn stage, let's get rid of it.
Yeah, I was going to say we missed that 6-month window. So then we had to do this elaborate pantomime with the Mickey Fairy coming. And I remember my younger son he's, okay, you're taking my pacifier. I'm taking my nap away from you. And that was it. So yes, sometimes there's retribution.
Yeah.
But I think it's a lot harder to take it away from like an 18-month-old or a 2-year-old.
Absolutely.
But that being said, there's 2 concerns. One, are you having to replace it a million times in the middle of the night? Then you might need to get rid of it. The second is there any concern about the child's dentition? And really, it's not a concern typically until your child starts losing baby teeth.
Yeah, absolutely. I also missed the memo on getting rid of the pacifier. So my daughter had one until about age 3. And then I was able to show her that there was like a crack in it. And she saw that it was dirty and that grossed her out. And she was done with them. She was a little fussy like the first night. But after that, it was like, it didn't even matter.
Well, there you have it. Just swap your child's fear of not having the pacifier with germophobia and you're all set.
Yeah.
Here's a good one. How to introduce room sharing. And I think there's a question a little bit further on about this, but I'd say that in general, parents overestimate the difficulty of room sharing. It's a relatively recent idea, and only in really Western countries that kids are going to have their own room. And that often parents, I think, worry about this more than they think they need to. The idea is that you room share, but not bed share with your infant for at least the first 6 months of age. So it's not like when there's a new baby that you're necessarily moving them right into the older sibling's room, which is the hot button time when parents are worried about it. Most parents do just fine with room sharing, and the parents really shouldn't feel guilty about it.
I see. The question is more about introducing room sharing to siblings. Is that correct?
Yeah,
Okay.
it's a short
Yeah, I
question, but
know. It can't possibly be introducing it with parents. So I would say, from my perspective, when I'm in a situation where, for instance, there's a baby and there's a 3-year-old or something, and they want to move the baby out of the room into the siblings' room, because I've had this a lot. So a lot of times people are like, I need the baby to sleep better so I can move them into the toddler's room or the big kid's room. And so I always recommend doing the sleep training in the parents' room, and then once that's done, moving the baby into the older child's room. In many cases, what we do is remove the parents from that room. If sometimes they're sleeping on a couch, it's just a couple of nights, and then they go back into the room, baby's sleeping better, and then they can make that transition to the older child's room. So I don't recommend sleep training the baby in the older child's room with the older child there. But
it is, I think it is possible, especially if the older child goes to bed later. Sometimes I've had parents sleep train if they're already in the room, have actually move the older child who's sleeping, it's usually the older child who's sleeping better, into the parents' room
yes,
for a few nights is another way to do it.
absolutely. Yep.
For the middle of the night awakenings, they tend to actually disturb the older siblings less than parents think they will, because little kids sleep so deeply. It tends to be less of an issue than people anticipate.
Yes. And that's similar to multiples. So if you have multiples, parents are always freaked out that the twin or whatever is going to wake the other. And in almost all cases I've experienced, that's not the case. They sleep right through it.
Here's a good one without a really clean answer. Tips for jet lag when flying overseas. Kids waking up at midnight to have dinner.
Ooh. I'll let you take the first stab at that one.
Sure. First of all, in my experience, a lot of the times the kids adjust more quickly to the new times than the parents do anyway. For parents on relatively short trips, if you're flying east, so all of a sudden your child's natural bedtime is at 8, you fly to Europe, their natural bedtime is like midnight or 1 in the morning. It can actually be, if you have a short trip, like 3 or 4 days, it can be fun to just stay in the later schedule. European hotels and homes tend to have these really wonderful shutters where you can keep it very dark. And just to have your kids stay up later and stay on this home schedule is often the easiest thing to do. It's actually a little bit harder to fly west because all of a sudden your kid wants to go to bed really early and get up really early. That's less fun for parents than being like, oh, we're going out to dinner in Paris at 9 o'clock at night. It's, oh, we're seeing California at 3 in the morning. I would say that generally there's no kind of magic solution here. If you know your kids are going one way or the other, you can try to habituate them a little bit. Melatonin, honestly, is tricky. Jet lag questions are hard because you really need to know the time zone someone's originating from and where they're ending up and what their sleep schedule is to provide granular information about the timing of melatonin or light exposures. There are calculators for this online, and it's the same for kids and for adults. But I'd say most of the time, if you're going for a really short trip, keep them on the same schedule if you can. If you're going for a longer trip, they're probably going to habituate pretty quickly.
Yeah, I usually just suggest getting them outside and into the sunlight if they're able to, and try to not force the schedule like a normal schedule. It depends. Again, it depends on how long they're going for. So if they're going for a longer trip, I just encourage getting outside into the sunlight, trying to reset the clock. Because sometimes I've had people who they go visit family for a month in the summer or something like that. And so in those cases, sunlight is your best friend, in my opinion, when it comes to adjusting to any time differences.
Natural light is very helpful, and also just being a little bit careful with screens. I think in general, light can be tricky. If you're doing longer trips, like going 12 hours or more, light can sometimes push you the wrong direction, but that's like a whole discussion. For most vacations, people are traveling 3 to 5 hours. where it's enough that they may feel it a little bit, but it's not so far that it's a complicated math problem to figure out what to do.
Okay.
Routines.
Okay, here's one. How much movement during sleep is typical in an elementary schooler, and how can I tell if my child is getting quality sleep? Solid bedtime routine and appropriate bedtime are in place.
Oh, I've got this one. I think this is a very interesting question. Generally, little kids move more than grown-ups. If a child's got a solid bedtime routine and going to sleep without difficulty, that's one box you want to check, because some children who move a lot at night do have a condition called restless leg syndrome. They will complain that their legs bother them at night, but sometimes they'll just say, my feet are hot, or I feel like there's ants on my legs. Sometimes they may not say anything about them, but the parents will just notice they're fidgeting, they're kicking a lot, etc. But the key is they're having problems falling asleep as well. If a child is falling asleep at bedtime without complaint, they probably don't have restless leg syndrome. The other thing to think about is there is a newly described disorder called restless sleep disorder. This is adjacent to restless leg syndrome, but there's no sensory phenomenon in the evenings. But parents will describe their kids flopping around like a fish or helicoptering around the bed, like sort of kids whose blankets are everywhere. The key part of that diagnosis is that children are also struggling during the day. They maybe have difficulty getting out of bed, which is, again, not typical of a younger child, more typical with adolescents, or having irritability during the day, etc. If you're concerned about that, typically it's a good idea to see a sleep physician. Usually is a sleep test involved in the diagnosis, and the treatment is usually checking a blood iron marker called ferritin and treating that if it's low. So yeah, if your kid's flopping around a lot at night, they're getting what seems to be an appropriate amount of sleep, but they're having problems getting up, or they're irritable during the day, it's probably worth talking about with your pediatrician.
That's interesting. I think a lot about my clients of on the younger side. So infants, young toddlers, and parents are always concerned about children moving in their sleep. She must not be sleeping, she's moving around. And I would say probably 90% of the time, it's just they're moving in their sleep. And I think there's definitely, you see the ones who are cause for concern, but I would think that what percentage of children suffer from that particular medical diagnosis?
Yeah, I think restless leg, it's not uncommon. It's probably 3% of kids, which doesn't sound like a lot, but most kids don't have any problems. Restless sleep disorder is newer.
Mm-hmm.
So it's more like the prevalence of kids presenting to sleep clinic, which of course is a highly selected group of people that have access to a sleep clinic. Somebody's concerned enough to ask for a referral. They've waited long enough for a clinic. And the prevalence there was like 10% of kids referred to a sleep clinic. I would say yes, most of the time your kid seems to be sleeping and they just move and you don't know it unless you go on a vacation and share a bed with them. The typical history of these kids when I see them in clinic is, oh yeah, there's one kid in the family no one wants to share a bed with when they go on vacation.
Yeah, I'm thinking more of modern technology, and parents, you and I both have feelings about video monitors, but parents
Oh yeah.
really just freaking out because of what they can see on their monitors.
Yeah, it's one of those things, sometimes ignorance is bliss.
All right. Do you want to get into melatonin?
Yeah, let's get into
All right,
melatonin.
let's talk about melatonin. About 7 weeks ago, we began giving our daughter melatonin each night at the suggestion of her pediatrician. After years of having trouble falling asleep and being a restless sleeper, she is now falling asleep quickly and sleeping soundly. But how long do we continue this? Our daughter doesn't want to stop taking it.
That one's from Christina. And you know what, Ariel, why don't you read the next one too? Because I think these are related, actually.
Kenzie says, what are your thoughts on melatonin? Our pediatrician said if your child is not sleeping well, the benefits of melatonin for a short time probably outweigh the risks. But what does the data say about long-term usage? That's a great question.
And that's from Kenzie.
Yeah.
So I think this is a really important topic. The background is melatonin is a hormone that your body naturally makes. Typically, melatonin is undetectable in the blood till about an hour before your habitual sleep time. It starts to rise up when it's first detectable in the blood. We call that the dim light melatonin onset. And melatonin secretion continues throughout the night until an hour after you wake up. So when you take melatonin over the counter, it is way over the amount of the physiologic amount that is being secreted in the blood. And melatonin, if you take it, the fancy word is exogenous. If you take a melatonin preparation, has two effects. Most people who are giving their children melatonin are looking for the hypnotic effect, which is the sleep inducing effect. That does not happen in every person, but it happens in a substantial number of them. So some parents will try melatonin and be like, oh, it didn't work. There's no reason to keep escalating the dose. The other is the chronobiotic effect, which is the effect on sleep schedule adjustment. Really dosing for that, that's if someone is staying up super late, you want to move the schedule earlier. We'll use a very low dose of like quarter to half a milligram at dinner time. So talking about hypnotic dosing of melatonin. First of all, I would applaud both of these parents because they discuss this with their children's pediatrician. Certainly, I can tell you that melatonin, although it's over the counter, it's a hormone. And the only other hormone I can think of that is taken over the counter is, believe it or not, vitamin D is also a hormone. But other hormones we think of that people may be prescribed are things like testosterone or progesterone or estrogen.
Yeah.
Because of some complicated issues about the way melatonin is regulated, it's treated as a food supplement and the quality is not that good. Sometimes the dose is high, sometimes it's low. Short-term melatonin dosed appropriately seems to be totally fine, like safe. If you're giving it with the advice of a medical provider, you're also working on behavioral sleep issues at the same time because it's not magic, it's not anesthesia. If there's other stuff going on, if your bedtime is mistimed, it can be very helpful. The appropriate dose for someone who's less than 40 kilograms, which is about 88 pounds, is 1 to 3 milligrams. For children over 88 pounds or 40 kilograms in the UK or anywhere else in the country, in the world, that would be up to 5 milligrams. Really, I start people on half a milligram of melatonin. I like ones that have third-party testing. For example, say NSF tested. Start at half a milligram and slowly titrate up by a milligram a week. And I'd say use it for a couple of months while you're also making sure your child doesn't have a device at bedtime, making sure the bedtime is age appropriate. In situations like this, for Christina, a child having long-term difficulty struggling to sleep, one of the terms for this is chronic insomnia of childhood, and melatonin is well studied in it. It definitely can be helpful. And it sounds like it may be with the other child for a short-term trial, it's less clear what the background history is. We actually don't know what the effects are of long-term melatonin, but the limited data we have, Beth Malo, who has done a lot of research on melatonin in autism, it did trials of about a year showing that it did not lead to premature puberty or changes in hormone profiles in children with autism taking melatonin for about a year. That being said, I think like with any medication, we use the minimum dose we need for the shortest period of time. So when parents are interested in coming off of melatonin after they've been using it for a while, often I'll just ask them and be like, just see if you can cut the dose in half if it's more than a minimal dose, more than half a milligram or a milligram, and see how that goes. Try it for a little bit, and then try skipping it. And it may be a disaster, in which case I think you could restart and then try again in a month or two. Recognize, though, there is also a psychological dependence. What somebody said, our daughter doesn't want to stop taking it. And I think it's worth I don't know how old that child is, but it's worth thinking about to talk about your child. Be like, oh, we're gonna use this for a while. We're not gonna stop it without a warning. But think about when you feel comfortable, we might try without it and see how it goes and enlist the child in making a plan. And now we're going to get a guest on to talk about melatonin in detail.
Yeah, it's what concerns me is how readily available it is and how quickly parents just grab it off the shelves at Target or CVS without understanding it really. And a lot of times I'll see in Facebook groups moms who say, I've been giving my child melatonin and they fall asleep right away, but they're still waking up all night. Why is that happening? And again, it's like people don't understand. I think you make a good point that you need to be looking at the behavioral at the same time, because I think people see that as the only solution to whatever their problem is. Because there have been another article about overdoses in young children because they find the gummies and they're taking too many. But sometimes parents just don't know what they don't know. And like you said, the dosages are totally different on. You can take 4 different brands and they're going to be totally different from each other. So that's concerning to me. And it's just a band-aid in many cases. So that's concerning from that perspective.
I would say that there's some important things you just said. First of all, yeah, it's basically candy, right? It's a gummy. We used to think that the overdoses weren't serious, but there was a big trial. It's definitely one of the most common reported accidental ingestions. And a small subset of children were getting hospitalized. They even reported a few deaths associated with it. So it is not totally benign. The other thing is that the melatonin dose is too high, can cause nighttime awakenings and nightmares. So parents are like, oh my God, my kid's falling asleep great, but they're waking up in the middle of the night and be like, you probably need to cut your dose back. And sometimes it actually works better at a lower dose. So that's why starting at a lower dose and stepping up is much more helpful. Now, there are a subset of conditions that it's very helpful in, and there's a lot of evidence for. One is attention deficit hyperactivity disorder. Another is autism.
So, as a pediatric NP, nurse practitioner, I frequently get questions on how to help parents of children with autism, especially regarding getting them to stay in their bed, calm down, and sleep through the night. What advice, meds, or resources do you recommend? And that's from Jen.
So we talked about melatonin, and there is a lot of evidence. I think the first key is, I guess, for the next question too, is behavioral methods do work as well in children with autism, but they often need more time and they need to go more gradually. And I should back up, if anyone's not, most people are familiar with the term autism, but autism is a neurodevelopmental disorder associated with like rigid and behavior and kind of stereotype behaviors like repetitive behaviors and social difficulties. It's becoming more and more common for reasons we don't understand. And it really, from a sleep standpoint, it can be incredibly challenging. Every child with autism has sleep problems, but many of them do. In my world, often kids will present to my clinic at age 1 or 2. The parents are doing everything right, and their sleep is totally dysregulated. It's all over the place. And often I feel like those kids tend to go on, especially if there's developmental or language delay, to have an autism diagnosis. So often parents are actually even struggling with the sleep issues before they even get an autism diagnosis.
I've definitely seen that in my experience, and you can see it from early stages. And in every case that I've been suspicious about, the parent has come back later and said that the child is on the spectrum.
There are some children that only have minimal impairments, and there are some children that really are struggling quite a bit. Physical activity during the day, especially vigorous physical activity, is incredibly helpful. So parents will say, my kid's in school during the week and they struggle with sleep. And on the weekends, we go to the playground, the trampoline park, and they sleep a lot better. So I think thinking about ways to get a lot more physical activity is helpful. I think that a lot of parents of children with autism resort to screens, which is understandable, but it can be toxic to sleep at bedtime. And actually, a lot of autistic children also have sensory issues. So a sound machine can be helpful. Some children like to be hugged or squeezed. Like parents will say, my kid comes into my room and they press against me really hard. They want me to hug them really tightly. In that situation, sensory measures like a weighted blanket, or my preference is actually for a Lycra sheet, like a stretchy sheet around the bed, can be quite helpful. I prefer a Lycra sheet because they're not hot. Compared with a weighted blanket, they don't fall off, and they're a lot cheaper. You can get one for $20 on Amazon. I'd also just plug this book, Solving Sleep Problems in Children with Autism Spectrum Disorders. This came out in 2014. I think they should update it. It is literally the only book on the market. And Beth Malo, who's at Vanderbilt, who actually, I really want Beth to come on our podcast soon. She's great. She has 2 daughters with autism, so she knows personally what she speaks of as well as professionally. The book is great for parents and for providers. Question here.
So the next question is, my 3-year-old autistic son used to sleep through the night until he started needing someone in the room with him. Are cry it out methods okay for toddlers age 3 and up, or is it considered abusive? We tried the chair method, but daylight saving time disrupted our progress. This is from Chris M.
Yeah. It's funny. A couple years ago, we tried to do a research project. We never got off the ground in the autism clinic to look at sleep disruption from daylight savings time, which seems to be far exceed what you would expect in terms of sleep disruption in this clinic population. They do tend to be very sensitive. So to tackle this, I think first of all, cry it out in a 3-year-old is tough and would not be my preference. I wouldn't call it abusive, but I also feel in children with autism who have a lot of difficulty with self-regulation, especially, they could cry for an infinite amount of time. They could cry all night. And it's not that I hear the desperation. I'm reading between the lines here. The chair method could be difficult as well. I think you might have to go very slowly. The other thing is, if he started needing things in the room with them, it may be worth exploring. Is there a sensory issue? There's some nighttime fears. Is there some anxiety? Certainly, in the US at least, before age 3, birth to 3 will help children like Chris's son. After age 3, it's often through the school district. Some children also are receiving ABA therapy for autism, and working on some of these issues during the daytime can help at nighttime. This child may or may not be verbal. If he is, it may be worth exploring if there's some nighttime fears and trying some other strategies. This child might do well with a huggy puppy style intervention. I would say just go very slowly, predictably with the child. One intervention my colleague described once, we've talked about this, bedtime charts can be really helpful and provide real predictability. And for nonverbal kids, actually, I had one colleague just had a Velcro strip in the bedroom, and every time the child did one of the activities, like they had a toothbrush, they had a little tiny book, they had a little tiny blanket, the child would pull it off the Velcro, put it in a bucket, and that was the signifier that it was time to transition to bedtime. But Chris, yeah, I would say absolutely. The daylight savings time stuff, give it time. Hopefully it will get better in a week or two. Right now when we're taping this, we're about a week out. So by the time you listen to this, hopefully it's better. But I encourage you to have a team and to have people help you work on this. It is a challenging set of issues. Okay. The next theme is night nursing and weaning. My 4-year-old baby woke up almost every other hour at night due to a cold, and I bed shared and nursed her back to sleep each time. Now she demands 2 to 3 feedings a night. How can I reduce her night feeds so she can sleep for longer stretches?
That's tricky. The first issue right off the bat is, if I was looking at this, first of all, I'd want to know, what does daytime feeding look like? Because I don't want to say, oh, you shouldn't feed your child that many times without knowing if the child is getting enough during the day. Let's say that the baby is getting enough during the day and they've just become, the sickness kicked off around the 4-month mark, which is tricky anyway. And now the child is just dependent on a parent coming in and maybe not even hungry, but now is dependent upon that feeding to fall back asleep. Now, I would say though, did they say, have the feedings increased? Was that included?
It sounds like it increased reading between the lines.
So if the feeding has increased, then you're probably not dealing with hunger. It's more likely that it's a dependency. So I think you have to start from scratch, and several of our other episodes address sleep training. And I would definitely say this is a good case for sleep training. I would also take a look at your daytime feedings, make sure there's enough going on there. Young infants often need to be nursed 8 times a day. And if they're only nursed 5 times a day or 4 times a day, they may be hungry overnight. But then I would pull back and look at, how is this child falling asleep? Are you nursing her to sleep, or are you putting them down independently and walking away? If you are nursing, there's some sort of a dependency here. So if you are nursing to sleep, you'll want to look at ways to back off of that and help your child learn to fall asleep independently. That's ultimately the goal. We have to start at the beginning of the night and stay consistent throughout the night. And that's not to say don't feed your baby. It's just to say that you don't need to feed your baby every hour overnight as long as they are healthy and regularly developing. And you don't need to attend to them every hour during the night if they're normally developing and healthy.
It is such a nuanced question, right? Because I'd say that if you're changing your kid's diapers multiple times during the night, it's probably really a full feed, whereas it might be also just nursing for comfort. Not every 4-month-old is quite ready for sleep training, but I think that, yes, this would fall under what a lot of people call a regression, right? Your kid gets a cold. And the interesting thing about what Chopin says here is like the child was sick and then the mom changed her behavior.
Right.
And then the child responded to that. This is parenting, right? It's a dance.
It's interesting that you say that because that makes me think of our episode that's about to drop with Dr. Garay and talking about how a lot of our sleep troubles are our own fault because we've changed our behavior. And in doing so, we've created a new habit or accommodation, as we were talking about, that the child becomes dependent on.
Oh yeah, no, I think we've all seen the kids where the kid was sleeping great, then they went on vacation, they bed shared, and then you see them 2 years later, and they're like, "Yeah, this is how it works now." But yeah, Chauvin, this is your child is so young. This is likely going to get better, I suspect, with time anyway. But the things to do, as Ariel talked about, might speed this up a little bit for you. Here's another one. This is actually from my pal, Dr. Michelle Caserta, who's a local pediatrician where I work. What are your thoughts on moms breastfeeding their 3-month-old to insert age here? I think it's probably 24-month-old, 36-month-old, all night from their bed if no one is complaining. Is there an age at which breastfeeding should stop to prevent dental caries, or can it continue until a parent wants their bed back?
I think that's a really tough question because we have to look at different cultures that have different ways of doing things and raising children. I particularly follow the AP guidelines of safe sleep, and so I personally never recommend bed sharing. I know it happens. I'm not judging anybody. I'm just saying I would never work with somebody that wanted to bed share. I would certainly help someone get away from bed sharing, but to me, that's just a no-go. If they're happy, then I'm probably not hearing from
likewise.
them. Yeah, if they're happy. And I don't think we can make that decision for people because in my opinion, it should never have started. But again, if they're happy with what they're doing, then we're not hearing from them.
Dr. Caserta is a primary care doctor, and they are. And I think a couple of things to shade this for. So let's take the safe sleep out of it and say this is like a 9-month-old or a 12-month-old. Mm-hmm. I think that sometimes when these patients come to my clinic, it's because the nursing parent is happy and the nursing parent's partner, again, because I don't want to be too heteronormative here, is not happy. And sometimes it can create some conflict.
I think that you just need to look at when is it appropriate for a child to stop feeding overnight? And it's very difficult to stop feeding overnight if the child is bed sharing with you. So I would often get questions, I don't want to stop co-sleeping, but I want to stop nursing all night. And I don't know how, I'm sure there are people out there that work with this, but it's like getting back to the idea of you're right in front of them. They can smell your breast milk and you're saying no. But I would definitely say that if a child is old enough to not need to be eating overnight, certainly there's a cutoff age for you.
Yeah, and I think also too about the dental caries is an important point. It's absolutely true. I think that this kind of is a little bit of a throwback to the heyday of attachment parenting, right? Yes. The sort of Dr. Sears idea that you should just essentially be have the family bed and nursing your children until they go to college or what have you. I feel like I'm seeing this a little bit less than I used to, but maybe just because those families don't want to hear from me. I think that Yeah, as pediatricians, just like you, Ariel, we're like very sensitive to safe sleep topics, but different strokes for different folks, right? My kind of take on it is everyone in that bed sleeping well at night. Then it's probably okay. But if somebody is not sleeping well, it's probably worth addressing.
Yeah, I totally agree.
So here I got some more for you under the heading of sleep training
Oh boy.
challenges. My 2-year-old son still requires a bottle and rocking to go to sleep, and sometimes wakes in the middle of the night crying for us. How do we break the cycle of bottle feeding and rocking to sleep? From Eli.
You have to just stop doing it.
Eli, we're not making fun of you.
No, no.
You're reaching out, which is the first step to fixing this. But
Yes.
yeah, sometimes you just have to stop doing things you don't like doing.
Yeah, and I always hear my child requires, and it's who's the parent sometimes, but I get also that you're tired. Like you just resort to what is working even though it's not really working.
Sure.
Ultimately, you have to stop the behavior that's causing the problem, and that is the rocking and the bottle. A 2-year-old does not need a bottle overnight. And again, we're talking about the teeth. But from a nutrition standpoint, again, if your child is normally developing and healthy, they do not need a bottle overnight. So this would be a case of investigating the various sleep training methods to start down a path of teaching your child to sleep independently. So yeah, I think you're going to have to stop the behavior and figure out the best method that feels right for you and your family.
Eli didn't mention if the child is also receiving calories during the middle of the night. I'll start. I agree that a 2-year-old, you should probably just throw your bottles out, maybe hide them in the attic or something if you're not going to have another kid.
Right.
But you know what? Burn your ships, right? Just be like, okay, we're not doing bottles anymore. Your child is not going to starve to death. If you want to go more gradually, you could keep the bottle but move it earlier, being like, okay, we're not doing a bottle in the bedtime. We're having our last bottle at dinner. You can have again, I'm like, just get rid of it. But
Yeah, I think that
use a
method
sippy cup.
works. Usually encourage parents to move to sippy cup or like a straw cup, which is what the dental community recommends. And
Yeah, I always hated those though, because there'd be like all the little pieces would get lost in the dishwasher.
yeah, just any of them. Sippy cups are the same way. Water bottles are the same way. So you're right. If you
So many
want,
water
you can
bottles.
say it's hard to know how far into 2 your child is because on the earlier side, they're not going to understand as well. If your child is 2.5, close to 3, it's possible that you can say, you can talk to them, you can have a conversation, or at least tell them what's going on and what you're planning to do. And then just consistency is really key.
Consistency is key. And it is, I think as parents, Eli, I don't want you to think we're coming down too hard on you. Sometimes it just comes out. If you don't like something, you just got to fix it. And your kid will probably adapt pretty quickly. Burn the bottles outside. You don't want to inhale them like an outdoor fire pit or
You can add
something.
the pacifiers too.
Here's one. Will removing a middle of the night sleep crutch for a toddler result in split nights as they adjust to falling back asleep on their own? I'm guessing this is a pacifier. Natalie, this is a question from Natalie. She did not specify.
A bottle,
A bottle, maybe.
middle of the night sleep crutch, or rocking, or it could be anything really.
Yeah, no, yeah. I think it's something that you have to deal with as a parent, right? So if you have to rock your child, as you said, if you have to get a bottle, if you have to find the pacifier that they have flung out of their crib and put it back in their mouth, if you get rid of that, they probably will complain for a little bit, but you're probably going to be sleeping better within a week if you get rid of it.
Yeah, I think that's the thing that a lot of people are afraid of. Like, they're scared. These children are demanding things, and they're afraid that if they change their behavior, the child is going to complain for a very long time. And the truth of the matter is, children adapt quickly if we are consistent in what we're doing and they're on an age appropriate schedule. A lot of times people are transitioning out of the Merlin sleep sack or something, or out of the snoo. Snoo's a lot harder, but it's much easier than you ever anticipate. And I always like to say, your choice is you can change the behavior and have some complaining probably for a week or so, or you continue down this path and there's no end in sight. So that's ultimately your choice. But those are the two options that you have.
I think, yes, sometimes as parents, we are so afraid to make these changes because the reason these things have evolved is because it is the way that we are surviving. When you like, I remember doing this with my kids being like, I hear the first stirring in the monitor, and I would be flying out of my bed to stuff the pacifier back into one of my son's cry holes, right? Just because I was afraid that they would be awake for longer. And I manufactured this problem for myself. And Natalie, I encourage you, take that crutch away.
Yeah.
Everything's going to be fine.
Yeah, truly. Just have faith in yourself and have faith in your child. Children learn so quickly.
So here's another sort of bête noire for many parents when I experienced myself, early morning awakenings. How do you deal with early morning awakenings, 4:30 to 5 in the morning, in a 10-month-old?
Okay. Early morning wakings are so challenging. There are so many different things that can cause early morning awakenings. One of them is we talked about having a dark room. Some children are just extra sensitive to light. And if the sun is rising early, they will open their eyes, see that it's light, and want to wake up. If this is something new, then it's probably related to something else. And one of the things Dr. Canapari and I talked about was, I don't know how many naps this child is on. Is there a nap transition happening? Do you need to drop a nap? Is there too much daytime sleep? A lot of times, what I usually look at is sleep totals. How much is this child usually sleeping overnight? How much is this child usually sleeping during the day? And someone just texted me today asking, it's actually a colleague just asking for some advice about a 6-month-old who is only sleeping 13 hours a day. Now, 13 hours is still within normal, but it's lower in the sleep needs. So we had to look at it and really got to limit daytime sleep to 2 or 2.5 hours if you want to expect an 10 and a half or 11-hour night. So looking at when is bedtime, what's happening during the day is really important. One of the biggest mistakes I think parents make with early wake ups is just getting your kid up. So I think what can be helpful is, I don't know if you've done any sleep training, but I would recommend treating it like a nighttime awakening, because 4:30 it's nighttime. That's really early.
If someone tells me 5:30 to 6, I'm like, your kids, you have to live with that.
Yeah,
The
that's
4:30 to
normal.
5, that's kind of like,
That's too early. Yeah, so those are the things that I look at. It's often a scheduling issue, and yeah, so I would say it's usually a scheduling issue, or the light, having the room not completely pitch black can really make a difference.
to amplify what you said, I'd say if this child is falling asleep independently at bedtime, this is probably a scheduling issue. If the child is not falling asleep independently at bedtime, working towards independent sleep at bedtime, aka sleep training, will likely address this. The other thing is looking at what you're doing. It is very easy to take your 10-month-old into your bed at 4:30 in the morning, and that will perpetuate this.
Exactly.
So we dealt with this with my younger son. I didn't know you then. He would just wake and talk, and I would bring him downstairs because he was waking everybody up, lie down next to him on the ground with a pillow, and he would just look at me and talk and stick his hands in my mouth for 45 minutes.
What were you thinking?
We called it mouth. We just,
Oh my gosh.
I was tired.
Yeah.
I guess what should I have done? He was falling asleep independently at bedtime. Should I have just ignored him, turn off the alarm? Or I think that's what we ended up doing.
Like, how early was he waking up?
Oh, 4:30 in the morning.
Oh yeah. So again, I treat that as a night waking. It sounds like you did sleep training with him because he was falling asleep independently at night. So
Yeah.
I would recommend treating it with your method. It's hard to get them, it's hard to be like a check and consult method where you're going in and out of the room at that hour. So if you have the stomach for it, I would just not go in until it's.
Well, I think that's what we did. I think we ended up doing extinction because I'm old school, but also because we just didn't want to be messing around. That's the trap with the chair method.
Right.
Right.
Absolutely.
You're doing the chair method. doing it 5 times in the middle of the night is pretty painful.
Yes, absolutely.
Here's another one from Gabrielle. My 22-month-old daughter wakes for 1 to 3 hours in the middle of the night several times per week. How can we help her get back to sleep faster?
To 3 times per week?
No, sorry, forgive me. 1 to 3 hours in the middle of the night.
Every night?
Several times per week.
Several times.
It's actually easier to understand if it's. I feel like the first thing you have to do, Gabrielle, is some really careful sleep diaries. Because of some nights, she is up for hours in the middle of the night, and some nights she's not. I feel like she is getting some naps you don't know about during the day. Or she's falling asleep in the car on the way home from daycare, or she's napping more at daycare. I feel like we're missing a part of the story. For those prolonged nighttime awakenings, it's usually not a behavioral problem. It's usually what Brett Kuhn calls too much time in bed syndrome. And this might be a kid where you think about, if it was happening every night, I hate to say it, but you might want to see if getting rid of this nap made this better.
Yeah, so I would say I totally agree with the sleep diary. I believe in that for everybody that's having struggles, particularly overnight, looking at daytime sleep, looking at what is the average amount of sleep your child is getting in a 24-hour period, and then how do you break that up between naps and night? So I would say this child might be having a really crappy night, and then the next day, like catching up on sleep, and then have a good night, and then they may still want to nap for 3. You may let the child nap longer after a bad night. And then the next day they sleep well because they're tired. The next day you let the child sleep as long as they want again during the day, but they've already caught up on the sleep that they missed. And so then it's affecting the overnight. I see that a lot, flip-flopping. Sometimes daycares or nannies or whatever, caretakers, don't log all the sleep the right way or appropriately.
Yeah. And I think that this is a situation where if your kid's in daycare, for example, you have to be like, okay, I'm working on my child's sleep. Can you just really give me some detailed stuff about what's happening?
Yeah.
Here's another one. My son refuses to sleep in his own room since his sister was born. He gets out of bed multiple times a night and doesn't sleep for more than a couple of hours in a row. What do we do? This is from Higlac.
I mean, it sounds like the child probably slept well previous to this because it's in.
Yeah, let's assume that.
Yeah. And I would say it's very common because I'm assuming it's probably a younger, maybe like 18 months, 22, 2.5, something like that. 18 months, don't fully understand. So I like to do a lot of work around hyping up the things of why is this baby getting more for the parents. Even it doesn't matter which parent, giving that child one-on-one time every day, even if it's for 20 minutes, if it's outside at the playground for 20 minutes, if it's reading books together for 20 minutes, but one-on-one time without the baby. And then you get
absolutely clutch.
You get back to that idea of charts and say you have to be a big kid and sleep in your own bed. Explain why the baby needs to sleep in the room. Tell them their role and have them model what it means to be a bigger sibling. And so turn it into a positive versus, and I get it. If you have a newborn, you're exhausted. So it's tricky, but I think that those are the things that I would recommend.
Praising the child for even attempts to stay in their room. How would you use a chart? Let's talk specifics here.
So similar to what you were describing, I like to call it like a behavior chart, or I don't like to say reward or whatever, because you don't necessarily need to use a reward because we know that children thrive on positive reinforcement. So it could just be a celebration at breakfast or something. I like to include just very simple stuff. Got ready for bed, brushed teeth, read books, got into bed quietly. And then the most important thing is stayed in bed all night. Now, in many cases, the first couple of nights, they don't get that sticker or pull that piece of Velcro, whatever it might be. But explaining to them and saying, you did great, look at all of this. And tonight, if you do this, you get all your stars or whatever it is. And so they can visually see that. But I think also, like a visual clock of their room is also extremely helpful. And I use that in conjunction with one of those bedtime charts.
And I would say the bedtime chart, especially for me, that's like a 3 and up kind of intervention for a younger kid. And I guess we're making some assumptions because if the child's coming out of their room, they're probably sleeping in a
Yeah,
bed.
that's true. Yep.
Definitely for a younger kid who's waking up more at night, I think, the key is more attention during the
Yep.
day. It will get better. So here's some napping questions. Should we try to match our 6-month-old's daytime daycare nap schedule on weekends or continuing following his cues?
There's so much that I need to know about that. I think having a schedule is important. So I don't love like napping whenever you see them yawn or whatever, because that can cause issues.
Especially at 6 months of age.
Yeah. So I think trying to follow some sort of a schedule is important. And if they're there 5 days a week, it's probably helpful to follow it loosely. However, I also find that children that go to daycare can sometimes be tired a little bit earlier at home from their long week away. And so if nap time is 9:30 at daycare and they seem tired at 9, okay, that's totally fine. I think there's a window going each direction, 30 minutes. Beyond that, if you're just like they're on 2 naps at daycare and you're doing 4 naps at home, I definitely wouldn't recommend that. Consistency in schedule and like number of naps is important. However, I will say when children are forced to drop naps at daycare or drop from 2 naps to 1 nap or something, they may need 2 naps at home or they may need a nap. There are ways to compensate for that over the weekend. However, for a 6-month-old, I would just try to stick within that schedule, 30 minutes each direction.
Yeah, it sounds perfect. I had a patient in New York City who was kicked out of his daycare because he gave his nap up early. Some daycares are more flexible than others about these sorts of things. And again, this is an older kid. Like I think he was maybe two and a half. From Michelle, do you have any recommendations for a 3-year-old that is inconsistent with taking a nap? Ariel, do you want to break the bad news to Michelle or do you want me to do it?
You can do it.
Michelle, I think your child is giving up the nap. It is a sad day as a parent when your child gives up the nap because it's great when they nap. It's not like a 3-year-old will just raise their hand and be like, hey, I don't think I'm going to nap anymore. They're going to nap some days they won't. Some days they'll fight you on it. And then they'll be miserable but until bedtime. It's never that smooth a transition. I think you offer a nap at the appointed hour. There, you can have an expectation that the child be quietly in their room for, say, 30 minutes, even if they are not napping. I had 1 month where my kids napped at the same time. It was bliss.
Oh, 1 month of
and then
bliss.
It ended. A month of bliss in my life.
In my life. I would also say that if that nap is affecting bedtime, absolutely do not offer the nap. And sometimes I know the quiet time is great and I do love quiet time. However, if the nap is causing problems at bedtime or overnight, you might have to keep them more occupied and be with them and doing a puzzle or something, or watching a 30-minute cartoon or, I don't know, a couple Bluey episodes, something like that, just to keep them awake. And I would also suggest backing up bedtime a little bit earlier for a bit because it's a big transition to go from napping to not napping. Compensating with an earlier bedtime for a little while can be very helpful.
So, okay. I think this next one's for me.
Okay, let me see. I can read it to you. So, in your book, you mentioned that both parents need to be able to do the bedtime routine. What do you do if your baby shows a strong preference for one parent? And this is from Lauren.
This is pretty common. Usually if it's a mom who's nursing, it's for that parent. Again, I think that sometimes this falls into gender stereotypes because in my clinic, I'd have a lot of parents come in with a man and a woman and the dad is, he won't go to bed for me. And it's like this learned helplessness. I think that it's very And in situations like that, where the other parent might feel a little bit left out or being sidelined, first of all, don't feel bad. It's normal for children to sometimes prefer one parent or the other. But the reason for the recommendation is that it can't just fall to one parent to always be responsible for bedtime. And if this becomes very rigid, things fall apart if that parent wants to go out for an evening and then they get a phone call when they're out having fun with their friends that their child won't go to sleep. And it just isn't fair. In situations like this, it's okay for the other parent to go for a walk if the weather's nice and be out there. I just think it's really the other part of the recommendation is don't have your bedtime routine so complicated that you need two people to do it because that works with your first kid. It doesn't work for your subsequent kids.
Yeah. I was just going to say, you mentioned single parents, and I was thinking of shared custody. That's a real reason why both parents would need to be on board and be able to do the bedtime routine because it's a true challenge. So I also just think it's important to have someone else, not even necessarily the other parent, a babysitter, because you can't be the only one that can put the child to bed.
Yeah. And the fact is, for a lot of the parents we see, bedtime's a stressful time. But with a little bit of effort, it can be a wonderful time. And it's awesome to put your kid to bed and read stories. It's adorable. I'll read this. My 6-year-old son was born with congenital heart disease. He has never managed to sleep alone due to various issues, including my health and his anxiety. He has never slept through the night, wakes with bad dreams, and does a little sleep talking. What can we do to help him sleep better? This is from Natalie. And Ariel, can I say that I see this all the time? So congenital heart disease, this is true of many children with issues like this. A child with congenital heart disease might need multiple surgeries in infancy. And there might actually be situations where they can't let the child cry. For parents of children with complicated medical issues, say there were a NICU baby who needed to be fed multiple times overnight or needed oxygen. All of a sudden, you end up with a 4 or 5-year-old where their health issues are better, but they have never learned to sleep independently. And I think that's what she's getting at. I would say in a situation like this, first of all, if your child is involved with medical specialists, just sit down with them and be like, hey, I'm struggling a little bit with this. Can you just let me know that all of these medical issues are now resolved? And if that is the case, I think sometimes this is a situation where working with a consultant, a sleep physician, or even a psychologist, if this kid is a little bit older, like a 6-year-old, because there is very likely this child, and it sounds like this mom has some unresolved anxiety for good reason. If your child has had to have multiple surgeries and hospitalizations, it's incredibly stressful. But it is a wonderful thing now if your child is doing better, and this is a great time to work on this. So I would say that working very gradually towards independence at bedtime, very gently, praising your child for making step towards independent sleep, and et cetera. And I'd say if there's a lot of bad dreams, waking through the night, sleep talking, if there's snoring, a sleep test may be worth exploring. Some conditions I see commonly, like children that were born early in the neonatal ICU, premature infants turn into 3 or 4-year-olds with sleep apnea. Just a medical evaluation as part of that is a good idea.
Yeah, I say anytime I get anybody with more complicated medical issues, I always recommend getting clearance essentially from their care team. And it sounds like mom is also dealing with health issues, and that is contributing to the 6-year-old's anxiety. I don't know if there's a great way to address that, but that actually makes me think of working with possibly a psychologist to address any anxieties that could be causing issue.
And a lot of times, actually, clinics like congenital heart disease clinics actually will have a psychologist or social worker as part of the care team who can help you with these issues. But hey, I got to pop off.
Get a dinner.
I got to take a kid to a fencing lesson, and then I got to go have a birthday dinner.
Is it your birthday?
Today's my birthday.
Happy birthday.
Why, thank you.
Oh my goodness.
But hey, I think, so this has been the Sleep Edit. Thanks so much for listening. I'm Craig.
And I'm Ariel.
Give us a shout if you have questions for future shows at thesleepeditshow@gmail.com. We'll put what we talked about in the show notes. And thanks for all the parents who submitted their questions. This was a lot of fun.